Hello everyone, we're back. It's Cheryl Koehn with Arthritis Consumer Experts, one of the patient organizations hosting the arthritis broadcast booth at this year's Canadian Rheumatology Association and Arthritis Health Professionals Association annual scientific meeting. We're in Montreal. This is our #CArthritis event, and we couldn't be happier than to have Dr. Andre Luquini with us in our studio. You're a neighbor. You're living in Vancouver, doing a PhD. You're a rheumatologist already, and clearly a rheumatologist with a very curious mind, because practicing for 5 years after you decided, and you've come all the way from Brazil, and you did so because you have a particular interest in arthritis and its impact in the workplace. So tell us how a rheumatologist from Brazil lands in Vancouver to do a PhD on this topic.
Well, first, thank you for the opportunity.
Oh, we're happy to have you.
In my practice in Brazil, I practiced 5 years there after I finished training, and I saw in the practice the work outcomes were very important.
Mm-hmm.
I received many patients that came from industry, and they had many needs that weren't met. Many lose their jobs or even kept to jobs unless they had pain that the medication couldn't handle.
Right. When you say industry, Andre, you mean just companies,
Companies,
out in the workplace?
Yes,
Yeah.
Mostly that made autos.
Oh, really?
Yes.
Okay.
And,
So some physical nature to the work.
Yes.
So okay.
Principally, yes.
Okay. And Vancouver, why Vancouver? It's not like you just said, okay, I'm jumping out of the plane here with my family, my 2 small children and wife. Why Vancouver?
In fact, Dr. Diane Lacaille was the main reason. Her field of research is related to work outcomes in patients with inflammatory arthritis, and that sparkled in my mind. We were already making an effort to look for the best, and we found, and she was so helpful with everything.
She's a wonderful person. We've interviewed her many times, and as you know, she's being awarded the Distinguished Investigator Award at this year's meeting. So apparently you chose very well the supervisor for PhD. You're already meeting with success and showing your peers more, and thankfully our Facebook and Twitter live audiences more about this particular area. I have rheumatoid arthritis, so I'm definitely one of the people that you would study, I guess, in your work. You're here in Montreal at this year's meeting presenting a poster. Tell us a little bit, tell us the title of the poster and what the question is and what you found as conclusion. Even though I know your work is ongoing, at least what you concluded with this piece of work.
Well, this is just the first poster derived from our work. We are studying about work outcomes in patients with inflammatory arthritis. Dr. Diane has already a program called Making It Work, where we got 565 patients from Alberta, Ontario, and BC. In this program, she offers vocational rehabilitation with interviews with occupational therapists, physiotherapists. It's a whole program, and I'm analyzing the data derived from this study to see its effectiveness.
Okay.
This is my thesis for PhD.
Yeah. So super important, because I mean, I know she spent almost her entire research career now on lots of other things, but this has been sort of bedrock to her research program, has been looking at particularly inflammatory arthritis in the workplace and the effects on people. And then from that early research developed this program, Making It Work with Arthritis. Your area of interest in particular is presenteeism.
Yes, this is the main analysis we did for this poster.
So explain for our audience what presenteeism is.
Okay.
Yeah.
This term, presenteeism, it's, I would say, not opposite, but close to absenteeism. Absenteeism is more widely understood as people are not at work.
You're not there. You're
yes,
in a
or
doctor's
sick,
office, you're sick.
or
Okay.
you're not working because you're not employed.
Right.
And it's easier to count. When you have presenteeism, this term means decreasing in work productivity.
So you're there,
But
you're
you are
at
not
your job
working
place,
the
but
same
you're
way.
not working the same way. And that's a result of someone's disease.
Yes.
Yes.
And this has impacts in the company, in the employer, but in the employee also.
Mm-hmm.
And these measures are not that easy to do. We have to make questionnaires, to analyze more qualitative data. We don't have numbers at first sight.
So in other words, you're going to go out to people like me who are working, who may experience presenteeism. So in other words, I'm not getting a lot done today, right? I don't feel productive. I feel I'm not doing my job. I mean, people may or may not feel that actually,
Yeah.
right? But in actual fact, you're trying to find a way to
Yes.
quantify that, even if the measurements you use are qualitative ones.
Yes. And
Not
try to find which factors impact on this decrease in productivity.
Right.
Fatigue, what else?
Pain,
Pains,
stiffness,
or if you're
yeah.
stressed, or if your disease is more active. Even commuting to work, we found difference. Age was a surprise. We thought that older workers would have more
presenteeism.
more
Yeah.
impact in the productivity,
Yeah.
but we found differently. The younger ones related more. One hypothesis Dr. Lacaille and we discussed is that maybe older patients they are more experienced with work, they have a different perspective. And as the outcome is self-reported, it may have some influence.
Yeah, so also, when you say older workers...
We divided in three groups.
Yeah.
Less than 30 years,
Yeah.
30 to 49, and more than 50.
Okay. In those groups,
Mhm.
and you say in the older group, you saw less presenteeism. Is that what you're saying?
Yes.
Yeah.
In the two older groups.
In the two older groups.
Yes. The less than 30, we related more.
Okay.
We heard more from the workers.
I see. Okay. And was there any difference across those groups in how long the person had had disease? So I just want to let our audience know.
Yes.
The older to two older groups, did they
Mhm.
have disease for longer?
Yes.
They did.
Most of
So
them,
here's
yes.
my hypothesis,
Yes,
Andre,
yes,
is,
of course.
you know, people with inflammatory arthritis, we actually gain a resilience. And when you compare us to other chronic disease patient groups, there is data that suggests that we have heightened coping skills,
Mhm.
right?
Yes.
So I think of myself, I'm sadly in that last group, over 50 group, but I've been working. I've never taken time off, but it's because I had a very supportive work environment.
Mhm.
I had very understanding employers. I know I was, I don't want to say a burden to them, but I didn't ask for many accommodations, and I probably should have.
Mhm.
So these are some of the things you're trying to tease apart
That's it.
in
Yes.
this data.
To increase awareness even for employers.
Yeah.
They can help. And patients feel safe to ask for accommodation. It's another challenge.
Yeah, you know, I've been very involved. I've been volunteering with a series of events called RA Matters at Work, and Dr. Lacaille has been one of the expert speakers at those events. And they've been open to the public, free. And it was astounding to me to see the transformation of the people that came into the room. One, because although our disease is not common, nor is it rare, right?
No.
I mean, we all know
Not really.
someone who has an inflammatory
Yes.
type of arthritis
1% of adults.
and likely is working, right? But they came into the room and they heard patient panelists sharing their experiences on how they disclosed. Some talked about good experiences, some talked about really bad experiences, not understanding clearly what the laws were that would protect them or what the requirements of a company, of an industry, as you say in Brazil, would have to provide to them. Are those some of the factors that you're looking at? Are those some of the outcomes that have been gathered, like the supportive environment or not?
Yes.
Do those things factor into presenteeism?
Yes. We have a variable called GCQ. We call it's
Sounds like
one
the
of
Home
them-
Shopping Network, but I don't think it is.
Yes, no, it's the component's job questionnaire.
Okay.
The content questionnaire
Okay.
is the name. And three variables we have there about support of co-workers,
Right?
support of the superior, the supervisor,
Yeah.
and the combined of both. They call social support
Right.
at work.
Okay.
And in this base analysis, we still didn't find it related to presenteeism
Okay.
in a statistical
So
way.
it's really something going on in the individual, is what you're saying there?
Yeah.
Yeah. So tell us the difference. What's this younger cohort, the earliest group in your paper here at the meeting?
Yes.
Describe a little bit about them.
In our study, the sample, we had more people with higher level of education and mostly of office work.
Okay.
We tried to put health workers and educational workers also, but the most of the sample
We're doing office
work.
Yeah.
It's not easy at all.
No.
Even, but it's a bit different. The relation with the employer and the tasks they
Right.
have to do every day.
Do you see big differences in your data so far? Just we know it's a very early on in your
Mhm.
work. Do you see big differences between those individuals in any of the cohorts I'm now asking, or those groups of patients? Do you see any big differences in terms of whether they're working for a small company versus a medium-sized company or a larger company? Does that impact?
Yes, this analysis we didn't.
You
do
haven't
yet,
done
really.
that yet,
Yes,
okay.
But we'll look for it.
Well, I know a PhD takes some time, so
Oh,
you've got some time to get through that data. And
Yes.
she's been doing this work. Dr. Lacaille has been doing this work, and I know she has a lot of data. And for our audience, it's really important to know that it's all fine and good to collect data, but if you don't look at it
Yeah.
and really try to, it's like working the Rubik's Cube or making a puzzle, hey?
Yeah.
You really need to try to fit those data pieces together, and not mushing them unnaturally together, but really looking at the different pieces of data sets and trying to understand what's going on with
Yes.
people like us.
In real life, that's the challenge. Not only numbers, how to put it in the real life and put yourself in the place of the patient. This is a challenge.
Yeah. Well, you are the perfect person to be doing that work, given your work as a rheumatologist. So many go into clinical research or what this would really be called health services research, I think, and don't have your clinical background. So I actually think it sets you up beautifully to do your best to think from that patient viewpoint. Do you have patients? I know Arthritis Research Canada has a arthritis patient advisory board. Do you have patients involved in the work that you're doing as research partners or advisors?
Yes, there are.
You
some,
do? Okay,
yes.
fantastic. I think that's one of the big strengths of Arthritis Research Canada.
Yes. Makes all the difference.
Yeah.
They sign all the way we have to go.
Yeah.
Full side.
How do you like Vancouver?
Oh, it's so beautiful. We love this summer.
This is now a tourism commercial here.
Yeah.
Yeah, it's fantastic. I mean,
Yes.
Brazil is amazing too, but Vancouver has such great natural beauty.
Yes.
Yeah.
So I talked to my wife. This is our first winter, real winter. We are getting used to it.
Yeah.
But it's
It's
beautiful
actually
anyway.
been pretty mild, although we did have a little bit of snow.
Yes, we've heard that.
Yeah.
For us.
A little different than in Sao Paulo.
But it is beautiful anyway.
Yeah,
We're
wonderful.
We're really loving the experience.
Wonderful. Tell us about, you're seeing patients here in Canada now? Are you actually able to treat patients?
Not yet.
Not yet, but are you trying to do that?
Yes, in this time I'm still having courses in the PhD
Okay.
program, so
Yeah.
I'm looking forward to start this process.
Okay, fantastic. Do you want to stay in Canada?
Yes, in this moment we have loved so
We
many
like that
things.
because we need more rheumatologists. We need young rheumatologists like you to stay on because probably, I don't know if this is a worldwide phenomenon or not, but in Canada, so many of our rheumatologists are nearing retirement or much closer to retirement than they are the early part of their career. So we're going to put padlock and chain on you and keep you here.
In Brazil now we have a new wave of young.
Oh, good. So, and I think similarly here in Canada as well. When you think about the work you're doing, Andre, and the theme of this meeting, building bridges, how do you feel your work fits into sort of thematically into that of the meeting? Yeah.
Well, about building bridges, when we practice as a doctor, you have to make bridges. You need the nurse, the physiotherapist all the time.
Yeah.
In research, it's not different because you have to collect data. Depending on your result, you will need the employer, the society, at all to make difference in the life of the patients you are trying to help.
Wow, I think that's a really great answer. One of the best we've heard so far, and that is, we can all sit here, and we heard Andre Picard speak at the opening night on Wednesday. He gave the keynote lecture, and he talked about all of these examinations, these reports that looked at our healthcare system and what was failing and what opportunities there were. And he said very candidly, I'm paraphrasing, obviously, could never speak with his elegance or eloquence, but I think he really just said, we just keep talking about it and not doing. And I think that bridge building and recognizing that you can work on one piece, such as presenteeism, but there are 1,000 other drops in the bucket of water besides presenteeism. And so we need to be looking at these reasons why our systems don't necessarily work the way patients or even physicians would like them to work. And we have to offer the broader society, like employers and our communities, answers that help support the patient as well. So lots of bridge building going on, and I really love it. Is there anything else you want to say about your work in particular before we ask if there are any questions from our audience?
I think the main message is you don't have to quit working. I think it's the most important when you receive a diagnosis of a rare disease or you have to deal with pain. Who has this knows what I'm saying. You think of your family and maybe you think, but how can I ask for accommodation? But it depends in the long way your health and everything who is with you, and you have the right to do that.
Yeah.
And if you do that, maybe the outcome can be quite better, even near if you didn't have pain.
Yeah.
That's the main thing, I think.
So fight to stay employed because it's important. First at the individual level. I mean, most of us on the planet work at something. And we do it for a large part of our day, actually. And that work, we derive personal satisfaction and society, feelings of societal contribution and the collegiality, making friends at work and the support you feel from them. So work actually is a super important thing for people with inflammatory arthritis. And we also know from literature, the research, yours and others, Andre, that people with inflammatory arthritis who go on short-term disability, then go to long-term disability, and they never return to work. And with today's kind of holistic treatment approach and the advanced therapies that we have and our knowledge around physical activity and how beneficial it is, there are ways to remain employed, but it's that, do I disclose to my employer or not? It's different for everyone, by the way.
Yes.
Some people are managing their disease so well, they don't need to.
Now we have technology.
While others, not so well. And it's when your productivity starts to drop, which becomes presenteeism, that becomes problematic for a worker. They may be unfairly judged as being a quote-unquote slacker when it's their disease which is preventing them to being as good at their job as they would like to be. So really important research work being done by you, Andre. Thank you so much for coming in. Anita, any questions from the audience?
The GCQ work questionnaire that you mentioned, is that available just in Brazil, or is that available
No.
here?
No, here, online. You can find online. I can send a copy if you need.
Okay, and what does a GCQ mean?
Job
Sam?
content questionnaire.
Job content questionnaire. And what types of questions does this tool ask? Like, what does the form ask
There are
you?
many
questions.
questions about support, about autonomy,
Okay.
about if it needs skills, for example, if it's repetitive work or if it needs more creativity.
Okay. So if someone Googles GCQ
Questionnaire,
it will probably come up. You can also search for it probably on PubMed,
That's how
I
I
would
found.
think.
Yeah,
Or Google Scholar, right? That's how you found it.
Yes,
Okay, perfect.
really.
You heard it from the expert. Other
And
questions?
lastly, are there any measurement tools for presenteeism?
Measure tools. We used WPAI.
WPAI.
Yes,
Okay.
and there's a shorter version for specific disease. They call SPH.
Okay.
WPI, SPH.
Okay. So you're already training the next person. You're
Yes,
still training and you're
yes.
training somebody else.
Come help us.
Yeah.
We need help, of course.
You know what? One thing we learned at the patient side of the equation is that it takes a village to do well, and that's certainly true in research. We couldn't have been happier to have the opportunity to talk to you, Andre.
Thank you.
I was absolutely floored when you said, "Oh yeah, I'm in Vancouver." I'm like, "What?" Which is where we're headquartered as a patient organization that does work nationally in Canada. So we're going to come start bugging you and seeing what you're finding out, so we can get it out to our readers and listeners and viewers. So thank you so much, and good luck, and
Thank you.
enjoy the rest of the meeting.
Thank you so much.
Yeah.
Really.